going about your day and everything seems normal. But suddenly, a constant and painful urge to run to the bathroom interrupts your routine. Now, multiply that discomfort by the millions of people experiencing the same thing. That's the reality of urinary tract infections, or UTIs. Today, we'll delve into what makes UTIs such a pervasive health problem and how we can combat their growing resistance to antibiotics.
My name is Kat.
Hey, I am Luj.
What is up? I'm Sen.
Hello, my name's Rai.
I'm Shay.
Today we'll be discussing a condition that affects millions of people globally, urinary tract infections or UTIs. Though common UTIs remain a significant challenge for both patients and healthcare professionals, not only because of the discomfort they cause, but also due to the rise in antibiotic resistance.
Urinary tract infections occur when bacteria, most commonly Escherichia coli, enter the urinary system. You might wonder, why is E. coli such a notorious culprit? Well, it's all about opportunity. E. coli lives in the gut, and when it gets into the urinary tract, it can wreak havoc. But it's not the only troublemaker. Other pathogens like Klebsiella pneumoniae, Proteus mirabilis, and Enterococcus faecalis can also cause UTIs.
But who is most at risk for these infections? Women, especially those who are pregnant, are at the top of the list. The anatomical structure of women's bodies makes it easier for bacteria to enter the urinary tract. During pregnancy, hormonal changes and physical shifts put even more strain on the bladder, making infections more likely. Besides, gender and individuals with anatomical abnormalities such as kidney stones or urinary tract obstructions are also at risk. And let's not forget that chronic conditions like diabetes weaken the immune system, giving these bacteria an even better chance to thrive.
Now, let's talk about the organ systems involved. When we think of UTIs, the bladder often comes to mind. This is where most infections start, leading to a condition called cystitis. The bladder, a muscular organ, is normally quite flexible. However, when inflamed due to an infection, it can become thickened and lose its elasticity. If left untreated, the bacteria can travel upwards, causing a more serious infections in the kidney. This is also called pyelonephritis. This is where things get dangerous as the infection can enter the bloodstream and cause widespread inflammation.
Speaking of inflammation, let us take a closer look at the pathophysiology of UTIs. The infection begins when a bacteria enters the urethra, travel up to the bladder, and start multiplying. Our immune system immediately responds by sending white blood cells to the area to fight off the infection. This battle is what causes many of the symptoms associated with UTIs. Dysuria, or painful urination, happens because the bladder's lining is irritated by the immune response. The urgency to urinate frequently is also due to inflammation, which triggers signals in the bladder telling the brain that it's full even when it's not. Lastly, the general discomfort in the bladder area is a direct result of this internal struggle between the bacteria and your body's defense systems.
Now, what happens if this infection isn't treated? Chronic and recurrent infections can lead to the thickening of the bladder wall, reducing its capacity and flexibility. In severe cases, the infection can progress to the kidneys, causing pyelonephritis, as mentioned earlier. And if that doesn't sound serious enough, untreated kidney infections can lead to bacteremia, where bacteria spreads into the bloodstream. This is life-threatening and requires immediate medical intervention.
When it comes to diagnosis, a standard urinalysis can reveal signs of infection. This test detects the presence of white blood cells, nitrites, and sometimes even bacteria directly. Urine culture is a gold standard for determining which specific pathogen is causing the infection and helps guide treatment decisions. It's also important to distinguish between asymptomatic bacteriuria, where bacteria are present but not causing symptoms, and an active UTI that requires treatment.
Go to treatment for UTIs. But here's where we encounter a big problem: antibiotic resistance. More and more strains of uropathogenic bacteria, particularly E. coli, are becoming resistant to common antibiotics. This has led to a rise in multi-drug resistant infections that are much harder to treat. In some cases, these resistant strains produce extended spectrum beta lactamases, or ESBLs, which can break down many antibiotics, making them ineffective.
So, what do we do when antibiotics no longer work? Researchers are now exploring innovative therapies. One promising approach is phage therapy, which uses viruses that specifically target bacteria. There is also growing interest in using antimicrobial peptides and nanoparticles to combat resistant infections. These therapies aim to destroy the bacteria's protective biofilms, a slimy layer they form to shield themselves from both the immune system and the antibiotics. Additionally, alternative treatments like D-mannose and cranberry extracts have shown promise in preventing bacterial adhesion to the urinary tract, though more research is needed to confirm their efficacy.
Let me introduce to you a clinical case that highlights the challenges of managing UTIs. A 35-year-old female patient, Mrs. A, presents to the clinic with symptoms of painful urination, frequent urges to urinate, and lower abdominal discomfort for the past 3 days. She reports no fever but mentions occasional chills. Mrs. A has had 3 previous episodes of UTIs in the last year. Upon examination, there is tenderness in the suprapubic area, and her urine dipstick shows positive nitrites and leukocytes esterase.
A urine culture confirms the presence of Escherichia coli, the same pathogen responsible for her previous infections. However, the culture also reveals that the strain is resistant to first-line antibiotics, indicating multi-drug resistance. Given her history of recurrent UTIs in the resistant strain, Mrs. A is prescribed a second-line antibiotic, along with recommendations for preventive measures, including proper hydration, cranberry supplements, and probiotics. The medical team discusses alternative therapies like the D-mannose and suggests regular follow-up to monitor her response to treatment. Mrs. A is also advised to avoid unnecessary catheterization to minimize future risk.
After 2 weeks of treatment, Miss A reports significant improvement, with her symptoms resolving completely. This case underscores the importance of personalized treatment plans and preventive strategies, especially in the context of recurrent UTIs and the growing challenge of antibiotic resistance.
Finally, let's talk about prevention. Since hygiene plays a key role in reducing UTI risk, simple measures like proper wiping techniques, staying hydrated, and urinating after intercourse can significantly lower the chance of developing an infection. For those with recurrent UTIs, cranberry extract and D-mannose supplements might offer some protection by making it harder for bacteria to cling to the bladder walls. Also, providing unnecessary catheterization in hospitals can help reduce the risk of catheter-associated UTIs, which are a major issue, especially in healthcare settings.
Before we wrap up, let's take a moment to reflect on the broader implications of this discussion. UTIs may seem like a small problem when they happen to someone else, but they represent a much larger issue in our healthcare systems. From the rise of the antibiotic resistance to the potential life-threatening complications, it's clear that we cannot underestimate their impact.
Thanks to research, better prevention methods, and innovative treatments, we can hope to change the course of this common yet complex health issue. After all, when it comes to UTIs, it's not just about fighting bacteria. It's about staying one step ahead of evolution.
With that, ladies and gentlemen, our presentation about the reality of UTIs come to an end. We would like to extend our gratitude to our professors, Ma'am Gina Sadang and Professor Mark Raymond Nava. Additionally, here are our references. You may scan the QR code for more details. Thank you for listening and watching.